What is gonorrhea? Both men and women can develop gonorrhea, an infection caused by bacteria transmitted through sexual activity. Gonorrhea often affects the throat, urethra, or rectum. Gonorrhea can also affect the cervix in females. Gonorrhea is transmitted through vaginal, oral, or anal intercourse, but after birth, infants from infected mothers can become ill. Causes of gonorrhea. When gonorrhea bacteria, Neisseria gonorrhea, enter your body through sexual fluids, such as semen or vaginal fluid, often through unprotected sex, you become infected. The opening of the mouth, vagina, penis, or anus can be entry points for germs. Both partners do not need to ejaculate to transfer bacteria. Sharing sex items that aren't cleaned or covered with a new condom can also contribute to the spread of gonorrhea. Symptoms of gonorrhea. Symptoms of gonorrhea infection often do not appear. However, when symptoms appear, they can occur anywhere in the body, but they often appear in the genital tract. Men who have had gonorrhea may show the following symptoms: painful urination, pus-like discharge from the tip of the penis, pain or swelling in one of the testicles. Women who have gonorrhea may show the following signs and symptoms: increased vaginal leakage, painful urination, bleeding from the cervix after intercourse and between menstrual periods, pelvic or abdominal pain. Symptoms of gonorrhea in both sexes. Both sexes can get gonorrhea infections in the throat, caused by oral sex on the anus or genitals, or in the rectum, through anal sex. Infections of this type are less common than gonorrhea, which affects the genitals. Some signs may be: in the throat, difficulty swallowing, itch, pain in the throat; in the anus, itch, vomiting, painful bowel movements. When to see a doctor about gonorrhea. If you experience any bothersome symptoms or signs, such as a burning sensation when you urinate, or a pus-like discharge from your penis, vagina, or anus, make an appointment with your doctor. If your partner is told they have gonorrhea, you should also schedule a visit to the doctor. You may not have any symptoms or indications to consult a doctor. However, even after your partner receives treatment for gonorrhea, if you don't receive treatment, you may reinfect them. Risk factors for gonorrhea. Sexual contact with people with gonorrhea is one of the main factors of the disease. Other factors include unsafe sex, sexual activity with more than one partner, history of sexual blood infection, and being born to a mother with gonorrhea. Complications of gonorrhea. 1. In females, you are more likely to face long-term problems related to gonorrhea. Gonorrhea and chlamydia are sexual diseases that can spread to the reproductive system and harm the uterus, fallopian tubes, and ovaries if left untreated. This may lead to pelvic inflammatory disease, PID. PID can damage the genitals and lead to persistent aching pain. Another possible problem is obstruction or scarring of the fallopian tubes, which can increase the risk of ectopic pregnancy, which occurs when fertilized eggs are implanted outside the uterus. Transmission of gonorrhea to a newborn baby. 2. In males, if left untreated, gonorrhea can lead to scarring in the urethra and painful abscess in the penis that can affect fertility, inflammation of the tubes that carry semen near your testicles, known as epididymis. Untreated infections can also enter the bloodstream, where they can lead to rare but serious problems, such as arthritis and damage to the heart valves. Diagnosis of gonorrhea. There are several ways in which a medical professional can diagnose gonorrhea. These methods include: 1. Urine test. Fluid sample for testing. A medical professional may take a swab from your throat, rectum, penis, or vagina to collect fluid. 2. Blood test. It may take a few days to get results. Treatment of gonorrhea. In most cases, gonorrhea can be treated with antibiotics. The most common form of treatment is an antibiotic injection, usually in the buttocks or groin. If you prefer, you can sometimes receive an antibiotic tablet instead of an injection. If you have any symptoms of gonorrhea, they usually disappear within a few days. However, pelvic or testicular pain may take up to 2 weeks to disappear completely. At the time of your next period, bleeding should stop between periods or during heavy periods. After treatment, it's usually recommended to go to a follow-up appointment so that another test can be done to determine if you're free of infection. To avoid reinfection or someone else's infection, you should postpone sexual intercourse until you and your partner receive treatment and recover completely. Home remedies and over-the-counter medications cannot be used to treat gonorrhea. See your doctor or nurse if you think you may have infected or if your symptoms don't go away after treatment. In these cases, you may need additional tests or a second round of treatment. Prevention of gonorrhea. Abstinence is the safest way to prevent gonorrhea and other sexually transmitted diseases. Of course, using a barrier method, such as a condom, every time you have oral, anal, or vaginal sex will also help reduce your chance of contracting many sexually transmitted infections. Another crucial step to stopping the spread of sexually transmitted diseases is to be frank with potential partners. So, it's a good idea to ask about STD tests and the status with your current partners, and to make sure you get tested regularly as well.